A newborn baby had a severe abdominal distension, severe abdominal pain, and diarrhea after being fed breast milk. Stool analysis revealed the presence of reducing sugar. So, what is the possible defect here? Your options are von Gerke's disease, diabetic ketoacidosis, lactic acidosis, or lactose intolerance. Welcome to Dentistry at Your Tips. This is Dr. Preeti and you're watching Fun with Biochem. Biochemistry is actually a very simple yet a difficult subject. Why? Because you need lots of cramming. Even after that, you forget things. So the best way to learn biochem is to solve as many questions you can. And solving questions actually help you analyze the situation from the broader perspective and help you retain what you have already learned. And how you have to solve these questions? You need to first understand the concept and then just mark out the keywords. If you're facing a very long question, in that long question there are just few words, just 2 or 3 words which you need to focus on. Like in this question, your keywords are breast milk and reducing sugar. So in order to arrive at the answer, you need to first understand the concept. So let's start with our today's concept, that is lactose intolerance. So first question is, what is lactose intolerance and how a person becomes lactose intolerant? So before coming to lactose intolerance, you need to know what is lactose. Lactose is a reducing sugar found in milk and milk products. Generally, what happens when you consume any milk product, this lactose reaches your small intestine. And in your small intestine, there's this enzyme present called lactase, which is used to break down this lactose into glucose and galactose. And from the lining of your small intestine, this glucose and galactose get absorbed in your bloodstream, and then your blood carries this glucose to the molecules or cells, which further utilizes it for energy production, that is ATP production, by your Embden-Meyerhof pathway, that is your glycolysis. So what will happen if there is no lactase or lactase is deficient in your small intestine? The lactose from your milk will not break down. So no absorption into the bloodstream. And it will go as it is to the colon. And in colon, there are certain bacteria which are naturally present there, and their action on lactose will cause the symptoms of nausea, vomiting, diarrhea, and all the other symptoms of your lactose intolerance. Generally, there are 4 types of lactose intolerance: primary, secondary, developmental, and congenital. In case of primary, there is generalized decrease in lactase because during childhood, there is lots of milk consumption by the child. There was lots of lactase also. But with time, as the child decreased the consumption of milk, need for lactase also decreased. So, child became lactose intolerant over the time. So, this is your primary one. As for the secondary, there was some underlying cause because of which the small intestine got injured or traumatized, therefore causing lactose intolerance. So by treating the underlying cause, we can treat the secondary one. Then comes developmental. In case of premature birth or any developmental defect, the small intestine is not fully developed, therefore causing the lactose intolerance. And then comes the last one, that is the congenital one. It is a type of autosomal recessive trait which is passed from generation to generation. That means the mother and father both should be the lactose intolerant people to cause lactose intolerance in the child. What are the risk factors? First major risk factor is increasing age. Then comes premature birth. Even some cases like cancer cases in which chemotherapy is given, it can also cause lactose intolerance because of small intestine injury only. Some underlying causes like colon or celiac disease or Crohn's disease also. And some ethnicities like Asian, American Indians, and Africans have shown higher risk of lactose intolerance. Then comes the diagnosis part. So how are you going to diagnose? There are 3 main tests. First is blood sugar, hydrogen test, and third is stool acidity test. So in case of lactose intolerance, your blood sugar level will never rise. Why? Because the lactose which was converting into glucose and galactose and getting absorbed into the blood is not getting absorbed now because it's not breaking down. So if you test blood sugar after meal or after consuming milk, it will remain same, which is not like that in normal cases. Second test is hydrogen breath test. People who consume lactose, even though they are lactose intolerant, they produce higher amount of hydrogen and methane gas because the bacteria in our colon is actually fermenting the lactose, therefore producing hydrogen and methane. Then comes the last test, that is stool acidity test. It is generally done in infants and small children as a confirmatory test. The amount of lactic acid or byproducts in the stool sample actually reveal if the infant is intolerant or not. So now we'll come to the treatment part, how you're going to treat it. First is of course dietary modification. Avoid milk and its product like yogurt also, you need to avoid it. You can replace your milk with other supplementary food products so that you're not lacking in nutrition in any way. You can also take lots of probiotics like curd. Probiotic food actually increases your gut health and decreases the symptoms of lactose intolerance. And as for the medication, there are many over-the-counter medication which people can buy. Two examples are Lactase and Milk Aid. There are the brand names. These tablets are basically your enzyme supplements. They are lactase enzyme supplement which are helping you digest your lactose. So now we have completed this topic of lactose intolerance. Now let's get back to our question. So what was the key points and key words which we need to take out from the question? So here are keywords of severe abdominal pain, diarrhea, breast milk, reducing sugar. All of these are indicating towards lactose intolerance. So all the long questions like these needs to be done by separating keywords. So let me give you another question. A 2-year-old child presented with liver enlargement. On investigation, blood sugar was found to be 50 mg%, uric acid 10 mg%, lactic acid 15 mg%, and ketone bodies were also present. Plasma cholesterol level was 300 mg%. So what is the likely diagnosis and what is the biochemical basis of disorder of its treatment? If you know the answer, do let me know in the comment section. Until then, keep working hard, keep doing lots and lots of MCQs.